Welcome back on this Tuesday morning. You know, there's more good news for people who take the popular weight loss drugs Wegovy and Ozempic. New data just out shows those drugs also help people with type 2 diabetes reduce their risk of obesity-related cancers. We want to bring in Dr. Frank Contessessa right now to give us more insight into these findings. Dr. Contessessa, welcome back to Morning on Merritt Street.
Good morning. Great to be here. Thank you.
Absolutely. You know, we kind of know obesity increases the risk of different cancers and other diseases for that matter. For some people taking Wegovy and Ozempic, lowering their weight gain now shows that they could also lower their cancer risk. We're looking at some of those cancers with the lower risks on our screen right now so our viewers kind of know what we're talking about. Let's talk more about why we're seeing these reduced risks this morning.
Sure. So what this study looked at, and it was kind of interesting, and it was specifically with diabetics. Now, let's remember, we're all hearing about these drugs a lot in the weight loss department, where people are taking these specifically for weight loss. Let's remember these drugs were actually developed as diabetes drugs. They're actually pretty good diabetes drugs. So what that showed was that for type 2 diabetics, in comparison to people who had to be on insulin, the people who were on these GLP1 drugs, the Ozempic, Wegovy type drugs, and there were pretty significant cancer reductions in these particular, there were 10 cancers that showed a reduction. And these tended to be obesity-related cancers. There are certain cancers that obesity increases the risk for. And they tend to be sort of gastrointestinal-related cancers, esophageal, stomach, colorectal, liver, gallbladder, pancreatic cancer. These are sort of gastrointestinal cancers that are related to increased obesity. So people losing weight and controlling their blood sugar better reduce the risks between 40 to 60%, depending on the cancers. Interestingly, there were 3 other obesity-related cancers that didn't show much improvement, breast cancer being one of them. Interestingly, that it did not show an improvement with breast cancer. But I think this is very good news. I think we have to be careful with this kind of news. It doesn't mean that everybody with cancer should be on a GLP-1 drug, but it does show the importance of controlling your weight and how much obesity can increase the risk of many of these cancers.
Yeah, I like that you kind of put the caution out there as we begin to look at these numbers and unpack them further. Lowering your weight, obviously that is going to increase your health. Let's talk about how much a healthy diet and exercise also plays a role in lowering this cancer risk.
Yeah, that's true. And I think the message from this study, beyond the fact that these drugs can help reduce the risks in this type of patient, I think the message is there are a lot of cancers, particularly deadly cancers, that being overweight and obese greatly increase the risk for. So I think the message from this study should be, hey, wouldn't it be great if you could reduce your risk by losing weight and not having to take a fairly heavy-duty drug to get that same effect? So I'm big on prevention and nutrition and exercise and weight loss on a natural basis. I don't knee-jerk prescribe these medications strictly for weight loss. I do on occasion, but I'm very selective about the patients that I give these to. So they are definitely good drugs, and I want to say I do prescribe them.
Yes.
I do think that they have a place. My concern is that people will take this news and say, wow, I need to lose 10 pounds, and I'd like to not get cancer, so I should be on one of these drugs.
Yeah, well said. Not everyone is aware or they know the symptoms of type 2 diabetes. And you did point out that this study focused on people with diabetes. Is there a test that a doctor can give so that we can know our risk for diabetes, or if we are showing symptoms and we're not aware of it?
Sure. The first question, the test is a very simple test. We look at something called the hemoglobin A1C, which is like a 3-month weighted average. It's not what's your sugar right now. It's what has your sugar been for the past 3 months. That's a very good indicator. Symptoms, clinical symptoms that people develop with diabetes tend to be being thirsty all the time, urinating more. So when people are urinating more frequently, that's your body trying to actually get rid of the excess sugar through the kidneys. So being thirsty, being hungry all the time, and urinating a lot are the most common symptoms that present with people that haven't had a blood test in a while, and they come in saying, I haven't been feeling well, and those are the most common symptoms that we do see.
Well, Dr. Frank Contesesso, we appreciate your insight and your word of caution this morning in terms of looking at this from a medical perspective. Thank you so much for joining us with that helpful information.
Thanks for having me.
Absolutely.